It is my pleasure today to introduce Dr. Mara Dacso, who is a board-certified dermatologist in private practice in Plano. Dr. Dacso went to medical school at UTMB Galveston and also the dermatology residency at Galveston. Dr. Dacso served as an assistant clinical professor at UT Southwestern from 2014 to 2019 and took a short break, and then she will be joining again at UT Southwestern in a few months. Dr. Dacso served in various panels, and also to her credit, she has several publications, especially one of her passions is leprosy. She published several papers on leprosy, and her main practice is medical dermatology and also aesthetics, and especially regenerative aesthetic practice. So today, Dr. Dacso will be talking about skin health and anti-aging, which is a very much needed topic that we all want to listen to, right? All right, let's welcome Dr. Dacso.
Hello, good morning, everyone, and thank you so much for inviting me to the organizers, Dr. Gangi and panel. Thank you so much for inviting me. I am in practice in Plano, so I do medical cosmetic dermatology there. And I do have a special interest in leprosy. I actually did research in leprosy throughout my through medical school and then in residency, and I do read pathology for the National Hansen Disease Program. So I kind of have my hands in a lot of different pots. But I really was excited about this opportunity because it actually isn't something that we know in dermatology that lifestyle medicine is so important, and we see it and we talk about it, but we really don't have a really good grasp on it, and the data really is not as robust as we wish it were. So I'm going to just kind of cover some of the diseases that we see a lot of in our practices, and really try to focus on lifestyle and how they intersect. So I do not have any relevant disclosures. And just as a caveat, my presentation unfortunately did not transfer completely, so if there are a couple little typos or formatting issues, I apologize, but I can always share my slides. So I actually want to go ahead and take a poll, just a show of hands. Who sees patients in their practices that have skin complaints? Pretty much everyone here. It is ubiquitous, really, in all of our specialties. What is interesting also is the question, who has observed that certain skin conditions may get better or worse with lifestyle changes, positive or negative lifestyle changes? So we really are seeing that without even consulting dermatology or knowing how to necessarily treat diseases. We can see that lifestyle modification really does affect our skin and our skin health. So really, at the end of the day, the intersection between all of these lifestyle factors and skin, in my mind and in putting this lecture together, really comes down to reduction of inflammation. And I think that's the bottom line, and what I really want to push is that we're trying to understand how inflammation impacts our skin, and it really is, again, ubiquitous. So I am going to go ahead and talk some about skin and inflammation, but really what is inflammation in general? It is the body's natural defense against tissue damage and germs, and that means viral, it means bacterial, and chronic inflammation is when our immune system doesn't know when to shut off. It's when inflammation is just constant, and we get long-term and we get profound tissue damage. And it's important to also question why we would recommend a lifestyle change and how that might impact, how that might decrease inflammation. Is that something that is reality? Is that something that we know to be a fact? Or is that something that we really just think is going to improve outcomes? So I think that's something that we all need to consider and look at the evidence and look at the gaps. So really, at the end of the day, data is lacking on how lifestyle factors impact the skin. We need more in order to make these really good recommendations. So I'm going to go ahead and review several common skin conditions that interact with lifestyle factors. So we're going to take a quick quiz. I don't have a poll system, but if you can just look at these and then in your head think about what this could be, and then we can go over them in turn. And unfortunately, D did not show up, but let's go ahead through ABC. I'm going to have you look at these. And then so these are, as you can see, we have an axilla in light pigmented skin, but also dark pigmented skin. So in pigmented skin, so we see the same condition in both skin types. And you see these cysts and nodules and scarring and tract formation. And so I want to just kind of get an idea of what you guys think. Is it A, MRSA, furunculosis, B, cutaneous tuberculosis, C, hidradenitis suppurativa? You guys are so good. Good job. So what is hidradenitis? It sounds like a lot of you know what this is. It is essentially a chronic condition where you get clogged sweat glands, which lead to painful draining nodules, abscesses, cysts and tunnels and scarring in the groin and axilla. It's more common in women and it's more common in Black individuals, and it is underdiagnosed. And it really has a very significant impact on quality of life. If you've ever seen a patient with this condition, we see them, unfortunately, a lot of times late, and they are usually depressed, and they're very, very troubled by their condition, and it can impact their quality of life in so many ways, their relationships, because these cysts, these nodules can drain, and they can have flares on and off. And hidradenitis, again, I'm sorry about the formatting, but hidradenitis is really a multifactorial condition. We're still learning so much about it, but we do know that, that there are certain associations with smoking, with obesity, with diabetes, with hormonal changes, even with pregnancy, and mental health concerns like depression. And so we also understand that these conditions are, these factors they can kind of be a vicious cycle that feed into the development of hidradenitis, or at least correlated with. And so I also think it's important to understand the biochemical links to diabetes. So at the basic science level, patients who have hidradenitis usually have an increase in inflammatory cytokines. So they have increased TNF-alpha, and that leads to impaired insulin signaling and function. And so when we're really interested in insulin resistance metabolic syndrome, this condition really is intimately linked to that. And the data is showing that, the link, and how it is important for us to address that. And so really at the end of the day, when you have that impaired insulin signaling, we're leading towards diabetes. And so these patients, even if they're young, coming in with prediabetes, with metabolic syndrome. So how can we impact patients with these lifestyle modifications? Well, nutrition for a HS patient, I do think it really is important to address, because if we understand that there are certain foods like dairy, like simple sugars, it sounds like keeps coming up over and over again, increasing insulin and IGF-1, if we're able to reduce these, a lot of times the pro-inflammatory environment can also improve. Increasing lean proteins, fruits, vegetables that are high in B12 and zinc, so they're more immunoprotective, and then omega-3 fatty acids and vitamin D supplementation can reduce inflammation. So that's hidradenitis, again, something we see often and something that really does have an intimate link with lifestyle modifications and lifestyle factors. Let's go on to the next quiz. So we see nodules, we see inflammatory papules, some excoriations, and then you have lighter skin on the left. And on the right is actually pigmented skin, where the erythema, the redness, is more of that dusky purple color. So that's still erythema, but in pigmented skin. So A, pityrosporum yeast folliculitis, B, cystic acne, C, Staph aureus infection, and D, prurigo. Cystic acne, right? So cystic acne, again, one that's near and dear to a lot of our hearts. We see a lot in our practices. And acne, as a lot of us know, nodules, papules, comedones, cysts, it comes in lots of different flavors, usually due to an increased oil production with a combination of bacteria, usually P. acnes, and inflammation. All of this coming together within the hair follicle, causing these cysts and these papules, leading to scarring and hyperpigmentation a lot of times, which can have a lot of psychosocial impacts down the road. And then it's really common, it occurs in most patients actually, and 85 to 100% of people will have acne in their lifetime. Women can have acne at any age, and although it's less common, 5% of women have acne through menopause. So it is something we see a lot of, and I think it's important that we understand some of the lifestyle factors that impinge on acne too. So a lot of times when we treat acne, it's not just one treatment, it's not just one topical. We need to understand the hormonal basis. Androgen blockade is really important for a lot of women because acne in women can persist. It can persist through the ages. PCOS, the interaction with PCOS is also very important. So our endocrinology colleagues, our internal medicine and family medicine colleagues, you are seeing an OBGYN, you're seeing this a lot. And so it's important that we work together to address acne at that level. Antibacterial treatments, as you know, topical antibiotics, oral rarely, and then benzoyl peroxide. Retinoids are also something that we use a lot of that increase your cell turnover and decrease oil production. Retinoids are fantastic. And then chemical peels, lasers, we do use those as adjuncts. But acne is not just treating with cream, as I mentioned. That's not just what we do. We really want to understand what is underpinning their breakouts. And we're seeing more and more young people with cystic scarring acne than ever before. And why, right? So I think that's something that we all have to ask ourselves. What is hormonally different from patients who are younger now versus 30, 40 years ago? Why is that change? How has that changed and why? So some studies have shown that there's a possible association with dairy, and most of the evidence is in whey. So reducing that may help. And then avoiding highly processed foods. It's not just chocolate, as our parents usually told us, avoid chocolate so you don't get breakouts. It's not just that, but there's something to it, sugars and dairy. Also, there's some newer data coming out on the microbiome, and I think that's important for all of us to understand that the microbiome really is that's kind of our milieu of good bacteria on the skin that keep that really nice homeostasis. And then in patients with acne, that homeostasis is disrupted, and certain bacteria like P. acnes can proliferate unchecked, and that can contribute to acne. So addressing that with pre and probiotics, and then there's some new products coming out with commensal bacteria that can help with that environment. So exciting stuff coming out. This is our next quiz. So let's look at this one. You should know. Derm 101, right? Is this psoriasis, tinea, secondary syphilis, or lichen simplex chronicus? Perfect. You guys should have done derm residency. So, psoriasis. Psoriasis is a chronic inflammatory condition. It can involve the skin, the nails, the joints. It is not just skin, however. It is systemic inflammation for a lot of patients, and that's so important for us to understand as clinicians in all specialties. We do think that there is a combination of genetic factors and environmental factors which play a role. So there are some factors which we think that can trigger psoriasis, such as pregnancy, emotional stress, even post-strep, and smoking. But we're also seeing a risk for chronic health conditions because of that intense inflammatory systemic inflammation that we're seeing in these patients. So these chronic health conditions that you are seeing in your clinics, these patients are also at higher risk for. Again, stroke, hypertension, heart disease, diabetes, all of those, obesity, anxiety, depression. So the treatment approach depends on severity. Of course, we want to decrease inflammation. We want to decrease inflammation to our skin, to our joints, to our internal organs. But a lot of patients, more patients than you think, actually need systemic therapy. Again, not just a cream. They're not going to be helped by a topical steroid. We really need to make sure we're targeting patients to initiate systemic treatment at an early period in their disease process. So again, we have so many targeted biologics out there now that have really good safety profiles. So the good news is that we have a large armamentarium. The bad news, they're extremely expensive, and a lot of patients don't have access to these medicines. So we have to get creative and it can be frustrating for physicians to get these medicines. It is important for these psoriasis patients to address lifestyle. We really need to. So obesity is shown to be associated with psoriasis severity. We need to be addressing this, and we need to be working in conjunction with our partners in other specialties. Okay, so Mediterranean diet. This has apparently come up over and over again, but Mediterranean diet and psoriasis, there is a link, and there are studies. There was a study in JAMA Dermatology that did show, large cohort study, it was about 35,000 patients in France, showed an inverse association between the Mediterranean diet, which is anti-inflammatory, as we know, and psoriasis severity. So something that we really can tangibly recommend to patients. Of course, we need more studies. We always need more studies. And then diet optimization to improve therapeutic response, yes. We really need to optimize their diet and address this at a cellular level. Next quiz. Okay, and I'm sorry this cut off again, but we have patches of erythematous patches, scaly on the neck, around the eyes, left pigmented skin. This is what it looks like, and on the right, lighter skin type. Is this A, seborrheic dermatitis, B, scabies, C, atopic dermatitis, or D, a tinea infection? C. Good job, guys. This is atopic dermatitis. That's exactly right. Atopic dermatitis is not just itchy, sensitive skin. It really is a genetic condition where we're having a loss of a specialized protein called filaggrin in our skin that is essential in our barrier function. When you miss this enzyme, this protein, when you're missing this protein, you cannot protect yourself from the outside world well. And so that's where the skin becomes scaly and dry and itchy and inflamed because the barrier is not functioning. Think of it like a brick wall, and then having the grout or in between the bricks, you have that cement or grout, and then that starts to crumble, it starts to break, then you have a brick wall with all of these holes in it. That's like atopic dermatitis, really. So there are genetic factors, but environmental as well, irritants. I have a lot of patients who come to me and say, I was fine when I took my trip, and a lot of times actually is to Southeast Asia. They'll say, I took my trip to Southeast Asia and I was completely clear, and then I came back to Dallas and I just broke out in this rash, this itchy red rash. I don't know why. Well, our environment is different, right? People who have an allergic background, people who have hives, asthma, food allergies are more prone to eczema, and then people who have a genetic background, predisposition. Another disease where skin microbiome dysfunction is important. So if we don't have good microbial diversity, meaning lots of good bacteria, lots of good germs on the skin that keep our skin in homeostasis, we get more pathologic bacterial overgrowth like Staph aureus, and these are pro-inflammatory, and it's this vicious cycle that continues. So prebiotics and probiotics are therapeutic targets for eczema, and so that really is something to keep in mind. So let's talk a little bit more generally, though. What lifestyle recommendations could we make that could improve skin health? Let's talk a little bit more about nutrition. So there is evidence that inflammation is increased from processed foods. We've talked about that already, but also low levels of nutrients like serum vitamin D, okay? And so there are, we really do understand that there are some nutrients that we should be recommending, but again, where's the data? We're gonna talk about that in a minute. Should we recommend our patients avoid certain foods? Should we tell them, hey, if you avoid dairy, sugar, and gluten, you're not gonna get these rashes, or your skin's gonna be better, in general. So should we do that for our patients? But we are evidence-based. We wanna make sure that we're teaching them the right way, and we're doing good by them. And we do have, there we go. We also have data on exercise, and I think this is one of those pillars of lifestyle medicine that is really important, physical activity. Anti-aging through exercise, actually there is data out there. So there was a study that was put out in Scientific Republic that showed that aerobic and resistance training rejuvenates aging skin in different ways. And how that's done is by reducing circulating inflammatory factors and enhancing dermal extracellular matrices. So what does that mean? Well, these people took a bunch of patients and they had them exercise, or they did a resistance training, and they were able to check on expression of certain genes that encoded for different ECMs, extracellular matrices, like proteoglycans and collagen and elastin proteins. And they found that they were upregulated in those patients. So finally, we have some understanding that exercise really does help our skin. We know that aerobic helps, but now resistance training has a little bit more for anti-aging component there. So what also happens to our skin when we increase stress? And I put lack of sleep in, I kind of bundled it because I think they're intimately linked. Well, our systemic chronic inflammation is essentially where our bodies are just full of inflammation, and if our skin is not able to maintain that homeostasis and is not able to intercommunicate with the rest of our body, and stress is really implicated in that, then we have a dysregulated immune response. So we're put at higher risk for immune-regulated diseases like autoimmune conditions. And so there are studies that have shown that there are increased autoimmune disease when sleep is lacking. So I think that all of this is intertwined. All of this is something that we can address with our patients. And then I do want to just kind of talk a little bit about the anti-aging discussion, because we really want to be able to understand how aging is related to these lifestyle modifications too, right? So we want to slow it as much as we can. That is what everyone wants. And I think that it's something that we should be able to address with patients with the right expectations, and they have to put in the work too, right? So here are my top 5 interventions that we can, as physicians, do as dermatologists to slow that process. Now, I wanted to show you guys an interesting photo. This actually has come up recently. You may have seen it on TikTok or Instagram. So this is the Cheers group, the cast. And these numbers actually represent the ages that they are in this photo. And so if you look at them, they look a little bit older than stated age, right? And so I think that's interesting because the millennials now will look at this picture and say, wow, they look older than I do now. Now I'm 35, but look at my pointer here. But he's 34. And so I think that it's something that we really kind of have this conversation with patients. What is it that we're doing now, or what do we know now that they didn't know, or is this just relative and we just think we look better? So the number one point that I want to really impart is that photo damage is now we know, now 20, 30 years later, we know photo damage really is at the crux of aging and anti-aging discussions. So we've got to protect, we really do. And how do we recommend protection from photo damage? Well, broad spectrum tinted sunscreens. But that's not just the only story, right? It has to be the right SPF. It needs to be over 30, otherwise we're not getting the benefit. It needs to be every single day, every day of the year, rain or shine. And why is that? Well, we're getting UV from our windows, we're getting it just from going from our car to the store. We're getting actually different spectrums of radiation from our devices even. So we've got to wear sunscreen every single day. And then we also know, just as a review, that UVA, the spectrum of radiation, is the aging spectrum, and that's the one that causes premature signs of aging, like photo damage, wrinkles, brown spots, pigmentation, etc. And then the UVB part of the spectrum is the burning. So that's what contributes to skin cancers and sunburns. So I mentioned about visible light, infrared radiation. Those can contribute to pigmentation. So your patients with melasma, your patients with pigmentation of different types, they're also getting different types of radiation that can contribute. So we've got to seek shade, wear your hat, wear your clothing, protective clothing. It's not enough just to wear sunscreen. Let's talk a little bit about products. So there's a lot of products online, right? TikTok. You go on TikTok and then everyone's got, the skinfluencers have all of their products they're selling. Well, what really works? And this is really, I think, my takeaways. that retinoids are so important as part of a skincare regimen. What do retinoids do? Well, they stimulate collagen production. They thicken the dermis, so that second layer of the skin. They promote DNA repair. They can even prevent from precancers, premalignant lesions. So we recommend retinoids for a lot of reasons. And then antioxidants. So antioxidants actually, vitamin C is our most known, most potent antioxidant. That's giving you an extra layer of protection underneath your sunscreen. But it also helps with pigmentation. It helps with fine lines. It's a great product. And then again, beware of the TikTok trends. And this is something that you can tell your patients. Listen, we don't know what these people are putting on their skin. We don't know if it's good for you. And in fact, it may cause more problems than help you.
Percentage of retinoids.
What did you say?
What's the percentage?
Well, so retinoids is a broad category. Okay, so we have the non-prescription retinoids, which is like the retinols, which are over the counter. And it really comes down to how they metabolically behave when they're applied to the skin. Are they in the active form, or do they have to be what's the word I'm looking for? Not compounded, but when it touches the skin, when it's on the skin, it has to be activated. Thank you. Activated is the active form, which is retinoic acid. And so retinol over the counter, but then tretinoin, tazarotene are retinoids that are in the active form, and they're more potent, so that's why they're prescription strength. So there's a lot of different percentages, but different types of retinoids. When we recommend, or we want to recommend vitamins and supplements to our patients for their skin health, what do? Okay, there's a lot out there on vitamins and minerals, and this works for that, and that doesn't work. Well, let's look at the evidence. There was a study from the Journal of American Academy of Dermatology that looked at the evidence for different oral supplements. And unfortunately, this is empty. Clear evidence for recommendation. We don't have clear evidence for this particular vitamin or this particular mineral. We have some evidence for vitamin D, nicotinamide, and polypodium leukotomas. And nicotinamide has the most evidence in preventing skin cancers. Vitamin D decreases melanoma risk, and polypodium leukotomas, which is an extract from a fern found in the Amazon, is considered photoprotective. But studies are lacking. They really are. This is something that we've seen, but it's not necessarily something that we can put our stamp on and say, you must, right? And then here is also important. So zinc has a lot of immune regulatory activities, we think, but there's still not enough evidence to recommend it. And then importantly, you may have heard about biotin. You may have even taken it yourselves or recommended it to patients. The truth is biotin in high doses is actually more damaging than good. And so we know that biotin supplementation has been shown to interfere with routine immunoassays like troponin T, thyroid-stimulating hormone, antithyroid antibodies, and so they can give inaccurate test results. We do not recommend high doses of biotin anymore. So vitamins and supplements, again, jury's out, unfortunately. Let's talk about energy-based treatments. Okay, so lasers, energy-based devices. Is it worth the investment? Is it going to really give us the outcomes that we want for our skin health? Is it going to slow the process of aging? Well, lasers are highly effective to treat photo damage. We know this. There are so many studies out there that have shown this. Lasers essentially means a controlled injury to the skin to improve cosmetic appearance and skin quality. So we have lasers for tightening, we have lasers for pigmentation, for blood vessels, and they really do work. But it takes time and it takes a commitment from the patient. It's not just a one time, it takes time. And it's also not just a one modality. We would need to treat with topicals, make sure they're protecting from the sun, and they're doing other things to prevent skin aging, or at least to slow the process. We even know that there are certain lasers that can treat precancerous lesions. So it's not just for anti-aging. Fractional non-ablative lasers can treat precancerous lesions. And number 5, in terms of interventions that we can use, is that wide world of injectables, which again, it's so prominent in the media now. Everyone's getting fillers, right? And Botox. I think that it's important that we break these down and understand what they are and how they can impact and not just anti-aging, but it is well-being. I think it is important to think of it that way. So neuromodulators, botulinum toxin has been around for a long time, but in terms of use for cosmetic reasons, about 35 to 40 years, FDA approved as Botox cosmetic. It works by inhibiting the release of neurotransmitter, acetylcholine, at the neuromuscular junction. So it actually blocks the nerve impulse. It doesn't actually specifically inhibit the muscle movement. The muscle itself, it blocks the nerve to the muscle. So it's designed to soften the lines of facial expression. It lasts for about 3 to 4 months. Hyaluronic acid fillers, I'm sure you've heard of them, you know them, you may have even gotten them. It reduces the appearance of fine lines and wrinkles and folds. It creates structure, support to the face and the lips. And as we age, we know that we lose fat, we lose bone, we lose collagen, and these and fillers are designed to help to support and reinflate those tissues that have lost volume over time. So I think that it's important also to talk about regenerative aesthetics because this really is where we're going. We talk about, lifestyle modifications are important. I think that regenerative aesthetics does fit in there somehow because we're talking about how we're going to improve and create more natural results for patients without putting too much chemicals in someone, essentially creating their own collagen, stimulating their own bone, their own fat. And we can do that now, and it's very exciting. Sculptra is a compound called essentially polyl-lactic acid, which is a potent biostimulator. That means it stimulates your own process of building collagen. And it also is shown to remodel bones, because again, we lose bone over time. And Radiesse is calcium hydroxyapatite. It's also a filler, but it also can be a biostimulator if you dilute it. It stimulates collagen and elastin production, can tighten and lift. And then exosomes is a hot topic in the derm world. Exosomes, which we learned, back in the day, are responsible for cell-cell communication, but we still don't know exactly how their effects are going to work downstream, if there's anything long-term that we need to be aware of. Exosomes are used now for topical application, but also in some countries, injectable forms. And it can help with so many different cosmetic concerns like pigmentation and skin texture and features of aging. But the jury is out. We're going to need more data on exosomes before we recommend them. So in conclusion, I wanted to just make sure we understood that the association between the pillars of lifestyle medicine that we looked at and skin health is important, but we really don't have the studies. We don't have that data to say, you gotta do this, you gotta do that in order to achieve those outcomes. But we know that for certain skin diseases, there are some associations. And so I think that is important to keep in mind when you see these patients in your clinics or you're co-managing them with your dermatology colleagues. It is important that we maintain a multidisciplinary approach to addressing lifestyle factors so that we can make sure that patients get their optimal treatment response and they're able to get the best outcome for them. And then also that the anti-aging landscape is rapidly evolving. There are lots of new technologies that are coming out, new products. It can be very, very overwhelming for us physicians, but also for patients to navigate. So I think we really do have to work together in really kind of helping educate our patients on what is out there and what really works. So here are the 6 pillars of health: nutrition, physical activity, managing stress, relationships and social connection, restful sleep, and avoiding risky substances. So what lifestyle factors impact skin health? Well, all of them. Right, so all of them, and I think that's the moral of the story for us all, is that we really have to find that happy medium. So thank you guys so much for your time. If any questions, I'm happy to take them.
Thank you, Dr. Dacso, for such an informative talk. We are open for Q&A.
Thank you so much. That was a wonderful talk. This is just a really general question. Regarding sunscreen, is there a benefit to chemical versus mineral, and is one better for anti-aging purposes? I don't know if that is
No, that's a great question. So chemical sunscreens, for those of you who don't know, that do have what are called, they're chemicals essentially. They're not just the minerals. And so they have other chemicals in the product to absorb UV, not just reflect them. And so when we're talking avobenzone, homosalate, all of those kind of chemicals that help to absorb. I think that they are fine. For those that tolerate them, I think they can be irritating for a lot of patients. So if you have a patient with really sensitive skin, I think that choosing a mineral-only sunscreen is their best bet because that's where you get the titanium dioxide and zinc oxide. So you're reflecting UV instead of absorbing UV. So I think it just depends on the patient. I will say that a lot of the most important is having a broad spectrum and that SPF of 30 or more. And then again, I do recommend a tinted sunscreen because you're protecting against not just the UV, but the visible light, the infrared, remember the aging types of radiation as well.
Dr. Dacso, thank you for this great talk. I'm a geriatrician, and so I see a lot of skin issues. People come to me for dementia, but they always have questions on their skin. So one of the things I'd like to get your opinion on is vitamin C. On your slide, you talked about vitamin C, the L-ascorbic acid. However, I was taught, and I'm curious what your thoughts are, that it's better if you're looking for a vitamin C product to get THD ascorbate because that's more lipophilic and 5 times more potent than ascorbic acid. So I'm curious your take on it. And my second question is, as a geriatrician, I see a lot of patients with skin breakdown, bruising. I was also made aware that products with vitamin K and arnica help with bruising. So if you could speak to those two things regarding the vitamin C when you're looking for a product, the THD ascorbate versus ascorbic acid, the efficacy plus the vitamin K and arnica for the bruising. Thank you.
Sure. So the THD tetradecyl hexyl ascorbic acid is it is absolutely effective. So first of all, there are several forms of vitamin C. The most important is that you choose one that is not going to break down rapidly and that is stable. And so the THD is, L-ascorbic acid is the pure form. And so I think that they're interchangeable. And so I would use either. The most important is that you know how it's manufactured and you also choose one of those that is stable. So THD, L-ascorbic, I think are fine. There's also, if you are familiar with SkinCeuticals, there's the ferulic acid. The CE ferulic is another one of those products that is also effective. So I think that was more of an example, and I think there are several out there, but there are other products that you'll find at Sephora, for example, that are not stable, and that might be THD, but maybe the packaging is, it's a clear packaging, and so it's sensitive to light, and it can break down more rapidly. Your second question was about bruising. So I actually do recommend a lot of arnica in my practice. Vitamin K can be helpful. I think arnica, there's a little bit more, remember there's no hard data on those, right? So it's anecdotal. I think arnica is great. There are some topical products with arnica in them. So people who have, and you may have seen this in your patient, called solar or actinic purpura on their arms. They just bump into something and they bruise right away. That's that solar purpura. And that's because they've had, over time, a lot of elastosis, actinic damage, and those vessels become less elastic and more leaky, and they're more likely to break. So arnica, I think, is great. Vitamin K, I've seen recommended. I don't, in my practice, recommend it so much. There's a product, by the way, if you do have a patient that would benefit, it's called Dermend, D-E-R-M, and I know I'm not sure if I can say that, but I have no relationship with them, but it has arnica in it. And it's over the counter.
Yeah.
You're welcome.
Can I have a question, Doctor? It was very talk. I just wanted to speak a little bit about the retinol. Is that your recommendation on a regular basis if somebody in your 40s or 50s comes to you, like for aging prevention?
Can you repeat the
triretinol?
The retinol.
Yes.
The tretinoin.
Yes, tretinoin.
Oh, yeah. So retinoids, I do recommend it all the time for any age. So not just for acne, because we know tretinoin works for acne, but we also know that it has those anti-aging properties. It thickens the dermis, it helps with collagen. Again, it's chemoprotective. So people who are on retinoids long term are going to have a better chance of not developing these actinic keratoses and premalignant lesions than others. So there is something to that, and I do recommend it often.
Is there a certain age or certain long-term issues you?
Not a certain age. I mean, the earlier you start, the better. I think you can reap the benefits over the years. You can't use it if you're for childbearing age. Not childbearing age. I'm sorry, for patients who are planning pregnancy. Childbearing age, of course. But if they're planning pregnancy, they would need to stop it just because the category is not approved in pregnancy. And even though it's topical, I wouldn't recommend it for those patients. But otherwise, absolutely any age. I would say people who are kids who are starting to develop acne, so young age, all the way through. You're welcome.
Long-term side effects of hyaluronic acid fillers.
The long-term side effects what are the long-term side effects of hyaluronic acid fillers? Well, I think that's a really great question, and I think it's something that we're still learning. But I would say that even though the HA fillers will say on label that they last for maybe it's 9 to 12 months, we're finding that these fillers stay in the tissues much longer. Much longer. They are broken down to some extent, but they are still in the tissues for much longer. So we're seeing patients who have had filler over their lifetime that maybe they've gone 10 years and they still have filler in them. Yeah, so I think that's the thing. And then we have, of course, this, you may have heard about this overfilled syndrome, where people just keep getting fillers and they don't know when to stop. It is so closely intertwined, that desire to continue to fill is so closely intertwined with self-esteem, with image, with feeling good about yourself, which in aesthetic dermatology, that's why we do this. We really want to impact patients at that level. But the problem that we have is that patients are shopping for fillers, and they're going to injectors who are not necessarily going to tell them no, and then they end up with too much product. And it's really, really frustrating. And I think that's why I've also developed an interest in regenerative aesthetics, because patients want to look younger, and as a mentor told me, not fake younger. So I think that it's important that we have those discussions with patients, that you do have to be judicious. And I tell a lot of patients no.
Thank you, Dr. Dacso.
You're welcome.
I'm sure a lot of audience have a lot of questions regarding
Please feel free to email
anti-aging.
me as well.
Sorry, my
Okay,
follow-up
this
was
is
for
the last question. I'm
My
sorry.
follow-up was for the vitamin K arnica. So a lot of elderly folks are on blood thinners, so like Coumadin. Do those topicals influence the levels at all?
Not to my knowledge.
Okay.
No, and in fact, I do also recommend, I don't recommend oral vitamin K, obviously, but I would recommend oral arnica, and they can get oral arnica at usually Whole Foods or Central Market. And I do feel like that is helpful. To my knowledge, it does not interact with Coumadin.
Okay. And off the TikTok that you brought up, like you have a lot of teenagers, preteens who are looking at those. In terms of the topicals, like the, rose hip oil, vitamin C, all of that, is there gonna be, have you seen any damage to kids using it at such a young age versus, hey, let's wait until a little bit later?
I think I actually personally think that it's very good that at a young age that there are kids who are interested in taking care of their skin. I think the issue is that they're misguided. And so the most important actives that a young person can be using on their skin is sunscreen, right? Using an antioxidant won't hurt anything, a good moisturizer, a good cleanser. But adding a lot of these other products, I feel is unnecessary. I do, especially for kids who don't have any signs of aging. And so I think the other thing, by the way, is that I think these kids will come to me and they'll say, okay, I have a 10-step routine and I'm not seeing any results. And so then you have to kind of start from the beginning, right? And a lot of times they'll come in and say, I have a rash, right? I have a rash and it's a contact dermatitis because they've been using all of these products that they're not able to tolerate and aren't right for them. So they're not curated for them.
Thank you, Dr.
Thank
Dacso.
you.
I
Okay,
would
one.
kindly request Dr. Dacso to kind of stay around lunchtime. I think audience have a lot of questions, if you don't mind.
Thank you.